欢迎收听这次的深入探讨哦。今天我们要来聊一个很多人可能都很有感的困扰，鼻子跟鼻窦的问题。你是不是也常常觉得鼻塞啊，或是被那个过敏鼻炎搞得很烦？
对啊，这个问题蛮普遍的。
我们搜到的资料里面，就是从最平常的感冒一路谈到说，可能需要动手术处理的状况。成人1年感冒2次很正常嘛，小朋友甚至更多。所以这次我们的任务就是帮你从这些资料里，抓出一些重点，看看这些常见问题是怎么回事，有什么方法可以处理啦。好，我们来看看。
没错了啊，鼻子其实功能超多的哦，不光是呼吸，还要帮忙过滤空气、加温、加湿，对不对？
对对对，还要挡灰尘、病菌什么的。
哎呀，功能这么复杂，所以出点状况其实也不意外啦。我们先从最常见的就是感冒开始讲起好了。资料有提到哦，常见的感冒病毒，像那个鼻病毒哦，常常是我们手没洗干净，然后去摸眼睛。
摸眼睛跟鼻子有什么关系？
有关系哦，病毒就跟着眼泪流到鼻子里面去了。
哇，原来是这样。
对，然后病毒进去之后，就会让鼻子内部，像是鼻中隔、鼻甲这些地方发炎、肿起来，分泌物也变多，所以你就感觉塞住了。
嗯哼，了解。
那有趣的是，病毒感染其实常常也会影响到鼻窦，这个可能就是我们最常遇到的鼻窦炎了。
哦，所以感冒就可能引起鼻窦炎。
可以这么说，但这里有个关键点，你可能常听到医生讲的鼻窦炎，通常是指比较严重的，需要用抗生素的细菌性感染。
细菌性的跟病毒不一样吗？
不一样，病毒感染之后，鼻窦不是会塞住积水吗？这个环境就比较容易让细菌长起来。
啊，趁虚而入的概念。
对，但是这份资料有特别强调一个重点，就是很多时候啦，即使真的有细菌感染了，我们身体那个免疫系统其实自己有能力，大概1-2个礼拜把它搞定，
真的假的？不用吃药？
不见得非吃抗生素不可啦。当然，如果说症状真的很严重，或者拖太久了，那抗生素还是需要的。不过这一点真的值得注意，可能跟很多人想的不太一样。
哇，这很重要哎！原来我们免疫系统这么早。那如果一直没好变慢性的呢？这是不是就跟鼻子的结构本身比较有关系了？
没错，这就进到下一个层次了。资料里面就有提到鼻中隔弯曲。
这个常听到。
对，鼻中隔就是隔开我们左右鼻孔中间那片，有软骨也有硬骨。它如果弯掉了，你想想，空气通道不就不顺了吗？
就像水管被压扁了。
就是这个意思。那好玩的是，很多人以为这一定是，比方说运动伤害啊，还是被打到造成的。
对啊，不然怎么会弯？
但资料说，不少人根本没有很明确的受伤印象，可能是很久以前一个不太大的力道，但它传到比较深的地方，造成弯曲。
哦，原来如此。
对，弯的形状有 C 型、S 型，有时候甚至会长出小骨刺，就是独立凸出来的骨头，这些都会挡住气流。
除了骨头弯掉，还有别的问题吗？
还有就是鼻息肉，这个跟鼻甲肿胀不一样哦。
息肉听起来有点可怕。
它其实是良性的啦，是鼻黏膜一直发炎，然后长出来灰白色的，有点像葡萄那样的组织。
灰白色的，跟平常红红的黏膜不一样。
对，颜色不一样，它也会塞住鼻子，影响闻味道的能力。处理起来稍微麻烦一点，用类固醇，吃的比喷的效果好，可以让它缩小一点。
那如果这些不管是弯掉的骨头还是息肉，吃药喷药都没用，怎么办？就要开刀了吗？
对，如果药物效果不好，或是问题比较严重，可能就要考虑手术了。资料里有提到几种常见的手术方式，比方说内视镜鼻窦手术。
内视镜是伸摄影机进去吗？
嘿呀，就是用小小的内视镜伸到鼻子里面去看，也要搭配一些特殊器械。哦，对了，手术前通常会做电脑断层扫描，就是 CT， 先看清楚里面的状况。
很精密的感觉。
对，手术的目的就是把挡路的骨头或是肿胀发炎的组织清掉，把鼻窦的开口，就是那个通道，把它弄大一点，让里面的东西可以顺利流出来。
清掉阻塞物，用什么清啊？
会用到一些特殊的器械，像是有一种叫后向钳，可以夹掉比较深处的骨头，还有一种叫微型吸脚器， 它可以一边刮掉多余的组织，一边把它吸走。
哇，听起来很厉害耶。那有没有创伤小一点的？
有听过一种叫气球扩张术的，好像是用气球把鼻窦开口撑大。不过这份资料提到，好像大部分有经验的医生还是觉得直接把阻塞的东西移除掉，效果比较确实啦。
了解。那鼻中隔弯曲也是用内视镜吗？
鼻中隔弯曲主要是做鼻中隔矫正手术，这个手术是切开黏膜，把弯掉的骨头和软骨看是移除掉，还是把它矫正。
把它矫正。
对，但最重要的一步是要保留一个 L 型的软骨支撑，这个很重要，就像鼻子的梁柱一样，如果没有保留好，鼻子可能会塌下来。
哇，那很重要诶。
非常重要。还有常常做完鼻中隔手术，不是一边变通畅了吗？
对啊。
但原本就比较通的那一边，可能会因为下鼻甲太大，反而塞住了。下鼻甲就是鼻子里面调节温度湿度的肉，
诶，瞧完一边塞另一边。
有可能。所以医生常常会一起做下鼻甲缩减手术，用微型洗脚器或是电浆刀把它缩小一点点，但也不能缩太多，不然鼻子会太干，也不舒服。
哇，美角很多诶。那手术完会不会流很多血呀？听说要塞东西在鼻子里。
是有可能。如果流血比较明显，有时候医生会用鼻填塞物来止血，常用的是一种海绵，干的时候细细长长，吸到血水或水分之后就会膨胀变软，可以压迫止血。
塞海绵在鼻子里，感觉很不舒服吧？
听起来是有点可怕了，但资料是说，通常不会增加太多不舒服的感觉，大概1到4天就可以拿掉了。当然了，如果手术很顺利，出血不多，能用是最好。
听下来，从一个小小的感冒到鼻子的结构，再到这么精密的各种手术，我们这个鼻子跟鼻窦真的是一个很复杂的小世界。
没错，
这次看下来，我们就更清楚了，鼻子的问题不只是感染发炎，那个结构顺不顺畅，影响真的很大。
对，
所以说，这一切的关键好像都围绕在2个点上，一个是通道到底通不通，另一个是黏膜健不健康，大概就是这2个核心问题，对不对？
正是如此。了解这些问题和有哪些解决方法，当然很重要，但这也带出一个问题，值得你回去思考一下。
什么问题？
就是说，既然很多问题的源头其实是像感冒这种常见的病毒感染，而且有时候身体自己就能对付细菌感染，对吧？
对。
那么在问题还没有变得很严重，严重到非得动手术不可之前，我们平常在生活里可以多做些什么来预防？或者在问题刚开始的时候，怎么样可以更有效地去应对呢？也许这样就能避免走向慢性化，甚至避免掉开刀的状况。
这确实是个好问题耶，预防胜于治疗嘛。
对啊，这或许就是我们可以从这些资讯里面找到为自己下一步可以做的事情的方向。
了解。
好的，那今天的深入探讨我们就先到这边，希望这些资讯对你有帮助哦。
Let's look at several of the most common problems that affect the nasal cavity and sinuses and explore solutions to these problems. Your nose is primarily an air passage, but in order to be successful, the airway must remain clean, humidify, and warm the air, and it must also handle undesirable particles such as dust, pollen, bacteria, and viruses. It should come as no surprise that problems can arise. One of the most common problems is the common cold. The average adult gets 2 colds per year, and children in daycare can have 10 or more viral infections per year. The rhinovirus is a single-stranded RNA virus, as is the coronavirus. A common event that can lead to catching a cold begins with unwashed hands. After touching a contaminated surface, you rub your eye and touch the mucous membrane in the corner of your eye. People do this all the time. The rhinovirus travels with your tears into the nasal cavity where it begins to spread and causes swelling and increased secretions. In some rhinovirus infections, only the nasal cavity is involved. The septum, turbinates, and other surfaces become inflamed and swollen. Secretions increase. The space between the structures narrows, causing congestion. In most viral infections, the swelling, increased secretions, and inflammation extends into one or more of the sinus cavities. Viral infections that involve the sinus cavities may be the most common type of sinusitis. However, when healthcare professionals use the term sinusitis, they're usually referring to a bacterial sinus infection, and in most cases, antibiotics are prescribed. Here we see swelling and excessive mucus production that is extended into the maxillary sinuses, but no collection of fluid. When the sinus cavities become inflamed, even as the viral infection begins to clear, it is possible for one or more of the cavities to become obstructed and fill with a puddle of liquid, often referred to as an air fluid level. In a small percentage of rhinovirus infections, the pooled secretions provide an environment for bacteria to gain a foothold. An acute bacterial sinusitis has developed. In most cases, when bacteria become involved, the body's immune system successfully clears the infection in a week or two. The fact that bacterial infections usually resolve without antibiotics is underappreciated. In some cases, antibiotics are warranted if the process is taking too long or if the symptoms are severe. Persisting bacterial infection can lead to the simplest form of chronic sinusitis, chronic bacterial sinusitis. When inflammation and swelling block the drainage pathway of one sinus and the infected mucus cannot escape the sinus cavity, a chronic sinusitis has developed. At some point, it becomes clear that medications will not resolve the infection. Surgically opening the sinus may become necessary. Here we see a common endoscopic sinus surgery procedure. An endoscope is used to examine the site of the obstruction, in this case, the right maxillary sinus. In almost all sinus surgeries, the details of the anatomy and the condition are already known from a preoperative CT scan, an essential part of the workup for chronic sinus problems. An instrument called a backbiter is used to remove portions of the uncinate process, and then a microdebrider is used to remove additional portions of the uncinate and parts of the maxillary sinus wall. The debrider bites small pieces of tissue and sucks the piece down the tube. Once the drainage pathway is clear, the sinus usually returns to normal and is left with a larger-than-natural opening. If the ethmoid sinuses become chronically infected, they can be surgically opened by removing the thin bony partitions that separate the ethmoid cavity into small cells. This creates one larger space that is less prone to obstruction and contains less overall mucosal surface area. Both powered and manual instruments are often used for this procedure. One of the technically more difficult sinuses to open surgically is the frontal sinus. Chronic frontal sinus obstruction is dealt with by removing the obstructing ethmoid cells in the frontal recess. Once the pathway is clear, the mucosal swelling and fluid collections will often resolve. There are specific instruments that are used to open each of the different sinuses. In addition to traditional sinus surgery with removal of obstructing and diseased tissue, some surgeons utilize balloon systems to stretch narrow openings and to crush obstructing ethmoid cells, creating more room for drainage. The balloon systems are touted as a less invasive technique, but most experienced sinus surgeons prefer removal of obstructing tissue. In some patients, the mucous membranes respond to inflammation by forming nasal polyps. Nasal polyps are benign inflammatory growths that represent focal swelling of the mucous membrane. In their most dramatic form, they can be seen protruding from the nostril. More typically, they are concentrated in the upper nasal cavity and can only be seen on nasal examination. During a standard nasal exam, if the head of the inferior or middle turbinate is enlarged, it can be mistaken for a polyp. Unlike polyps, enlarged turbinates are usually reddish in color, whereas inflammatory polyps are more often pale gray in color. Polyps can obstruct airflow, they can block sinus drainage, and they can interfere with the sense of smell. Steroids usually shrink nasal polyps and can provide some relief. Oral steroids are most effective, but steroid sprays are helpful. There are several underlying types of chronic sinusitis that can lead to polyps. Patients with prominent polyps have one of the most difficult sinus problems to treat. Airflow is what the nose is all about. It functions best when the slot-like passages on each side are shaped correctly. The nasal septum sits between the left and right airway. Deviations in the shape of the nasal septum are a common cause of airway obstruction. Nasal septum deviations are often blamed on injuries, but many times there is no clear history of an injury. When the nose is impacted, such as in a sports injury, fight, or simply birth trauma, the impact occurs to the front of the cartilage, but the force is transmitted farther back, often causing deviations well away from the actual impact. There are several typical configurations that a deviated septum can take. The C-shaped deviation. The caudal deviation. Caudal means the anterior-most part of the cartilaginous septum. The S-shaped deviation. The nasal septum sits in a trough of bone called the maxillary crest. Imperfections in the alignment of the septum here are common and can cause problems. The septum can be off of the midline, or the trough of bone itself can be off of the midline, or they are often deviated together. Each of these configurations can cause airway obstructions. Another common abnormality is an isolated ridge of bone called a septal spur. Septal spurs can cause airway obstruction, but they can also cause referred pain if they indent the inferior turbinate. Cartilage supports the nasal profile. An L-shaped portion of the nasal cartilage must be maintained or reconstructed to prevent collapse of the nasal profile. Deviations of the cartilage at the critical nasal valve location can obstruct airflow with minor misalignments and can be especially challenging to correct. Repairing a deviation usually begins by making an incision in the mucous membrane and carefully elevating it off of the bone and cartilage. Once it is accessible, the off-center portions of bone are removed or repositioned. Cartilage is straightened using various techniques. Once the deviation is corrected, the mucous membrane is returned to its original location and sutured into place. The inferior turbinates tend to change size over time to fit the available space. They often fill the concavity of a deviation. When a deviated septum is restored to the midline, the previously more open side can become obstructed because of the size or position of the middle and inferior turbinates. A turbinate reduction is often performed in conjunction with a septoplasty to create a symmetric airway. Turbinate size can be reduced using several techniques. A turbinate reduction can be helpful to improve the nasal airway in several situations and is often done as a standalone procedure. Here we see a common method for turbinate reductions done under anesthesia. The microdebrider is used to carefully remove the excessive tissue from the bottom of the turbinate, and the plasma wand is used to shrink the remaining portion. When the turbinate heals, it recontours into a smooth surface. It is important not to remove too much tissue, as the turbinates have a vital role in humidification and airflow regulation. Nasal packing is an important tool in some types of nasal surgery. There is bleeding with most nasal surgical procedures. In many cases, the bleeding is brief and minor and stops with natural clotting. In cases where there is more persistent bleeding, packing is often required. Packing applies pressure to the site of bleeding and reduces the flow. There are several different types of material that are used as packing. One of the most common is a sponge made from cellulose. This type of packing starts out firm and narrow. Once it is inserted, it is wetted with saline, afrin, or blood. The sponge expands, becomes soft, and applies gentle pressure to surrounding structures. Patients have often heard terrible stories about packing, but in most cases, packing does not add much discomfort. It is best when no packing is needed because there is less of a pressure feeling and more airflow. The sponge is placed in position in its dry form and then expands to provide pressure. Packing against the inferior turbinate is often placed after a turbinate reduction or septoplasty, and packing under the middle turbinate is placed for sinus surgery. Packing is usually removed in 1 to 4 days in the office.